Yeah, great. So good evening, everyone. Welcome to another session in the Nursing Edge series webinars from Walters Kluwer. Today's topic, as you know, that AI and robotics in healthcare, evolving roles for nurses. Now, as we all know, nurses plays a vital role in integrating AI and robotics into healthcare. They use AI for real-time data analysis and decision support, while robots handle routine tasks, allowing nurses to focus on patient care. AI system monitor patient vital signs, alert nurses to any issues. Nurses also ensure ethical use of these technologies and collaborate with developers to create user-friendly tools. So it's very, very technical, and that's why the reason that as AI is right now coming into the regular life, and especially it is advancement in the medical field also. So we requested our author Suresh K. Sharma, who needs no introduction, but still I can say a few words about him. He's a professor-cum-principal of College of Nursing, All India Institute of Medical Sciences, Jodhpur, India. He has over 20 years of teaching experience in undergraduate, postgraduate, and doctoral programs in nursing. He was the University Gold Medalist in his undergraduate and postgraduate programs, and the list goes on. So without taking more time, I request Dr. Sharma to please start a session, sir. Sir, it's all over to you. Thank you so much. Sharma, sir, am I audible to you?
My screen is visible to you?
Yes, sir. Yes, sir. Go ahead, sir.
Right. Thank you so much, Ravi, for your kind words. And thank you so much for the opportunity to speak to young minds. And thank you all the participants who could spare their time in this late evening. I have been asked to talk about a topic which everybody of us speak today, that is artificial intelligence and robotics in healthcare. And there's a big question. What is the evolving role of nurses? And can nurses be replaced by robots? If I remember the movie Chitti, O O2, 2O, sorry, uh, that reminds back me that robots, maybe future generation robots, may have all the capabilities of critical thinking, decision making, and doing all manual works. But what they miss the touch which human being has, the engagement which human being can ensure, the listening power which human being had. Siri hears us, but Siri cannot engage us. So these are many pertinent questions. Within that, for next 30-35 minutes, I'll take you through what the challenges and opportunities AI and robotics are bringing for nurses. There had been a remarkable transformation by integrating artificial intelligence and robotics in healthcare. You see that the artificial intelligence and robotics are days of talk in healthcare disciplines, and they are more of talk in nursing sciences. They has revolutionized the healthcare from diagnosis to treatment and administrative tasks and patient care. I was hearing one day that there will be time when we will not be requiring the radio diagnostic specialty in medicine, because AI will, when you infuse the data of CT, MRI, X-ray, it will give you perfect diagnosis and more accurate diagnosis than human being. And similarly, the automated blood analyzers and other machines which can give you a quick and better reports. When we talk about what AI and robotics has contributed to healthcare, it has improved our efficiency. We may make a error, we may misspell, but AI will not misspell. It will not lead to grammatical inaccuracy, which human beings can do. So it will ensure efficiency and accuracy in healthcare services. And artificial intelligence can simulate the human intelligence as a machine. And now it is used in every field and horizon, whatever we talk. It is in academia, it is in healthcare, engineering, accounts, administration. And today we are talking about whether it can be also contributing substituting or supplementing the caring role of nurses. When we talk about robots, you might have visited a restaurant where robot have brought and served you as a waiter. These machines are designed to perform automated tasks under the human controls, where the commands are given by humans and they perform the activities. They can be simply or highly advanced and capable of learning, adapting, or even making decisions by using artificial intelligence. By this thought, we can postulate there may be robots which can be in hospitals where commands will be given and they will be accurately monitoring the patients. They will be accurately collecting vital signs data from machines which are there, and they may be giving all the required tasks which nurses do. This is we are postulating today. AI and robots, when talk, we all have seen that they are very much capable in analyzing medical data and diagnosing disease and predicting disease outcome and personalizing treatment for these patients. They have also enabled precision and minimally invasive surgeries and reduced the recovery time and improve the patient outcome. This already we have seen in practice. And these technologies have also streamlined administrative tasks, allowing healthcare professionals more time to focus on patient care rather than documentation, data collection, and so on. When we talk about AI and robotics, they have really brought a transformation in how the care is being delivered. But amidst this buzz of technology advancements, there's a crucial question remains. Can technology replace irreplaceable human touch in nursing? And I think answer is no. That can never happen. There may be an amount of technology, but that engagement, hearing, human touch, empathy, care, compassion cannot be brought by machines. Nurses' collaboration in AI and robotics has deep understanding and deep contributions for future, because they can have a patient care needs understanding and unwavering compassion and perfect positioning of work alongside AI and robotics. So what I wanted to tell you here is that the complementary contribution of AI and robotics are going to definitely have in future healthcare the way nurses are handling today. This powerful combination of nurse and artificial intelligence and robots will unlock future of enhanced patient care, improved efficacy, and more fulfillment of nursing experience, where we'll be more accurate and we will be more efficient. But these are the 4 questions which I need to talk today: how nurses will be collaborating in AI technologies and robotics, and what they will be collaborating, when they will be collaborating, and why they will be collaborating. When we talk about how they will be collaborating, automating routine tasks. There are many tasks where we require nurses and they could be automated by machines. For example, nurses are spending a lot of time in monitoring vital signs. If we attach the electrodes and there are machines which record these, and we have bedside monitors today, they record blood pressure, they record pulse, they record temperature, they record ECG, and these bedside monitors are aligned with medical record, electronic medical record, and where time-bound data is automatically entered, and nurse only can see if there is something going up or something going down, and can use this for critical decision making, critical thinking and decision making for patient care. So this automating routine task will save the nursing time, and nurses can contribute more for direct patient care. Similarly, improved patient monitoring. When patient going home, if you would like to monitor their vital parameters after they go home, then they have a wristband which is catching their parameters and communicating you. Similarly, aiding into decision making. You have data with you and you would like to make a decision that this treatment or that treatment, and the AI can use algorithm and can tell you that this nursing intervention is going to be more efficacious and beneficial, and you can choose that. And last but not least is it will enhance overall efficiency of nurses, the way they take care. For example, one example I would like to tell you here is that when a patient is having a breathing problem, automated monitoring system is monitoring breath rate, and then the AI based command will be given to bed that they will be propped up position, and even nurse is busy with other patient, the bed automatically will take a patient into semi Fowler's or high Fowler's position as based on the need of the patient. So this is how our efficiency and efficacy of care will increase progressively, and nurses will have reduced workload and improved patient outcome. And we all talk globally, there will be huge shortage of nurses. May not be in countries like India, but in developed world where the population is aging, there are more and more nurses are required, whereas there are less takers for this particular discipline. And when we talk about what nurses will contribute, nurses will primarily contribute into data infusion to the machines. So the machines will become more intelligent over the time. And robotic process automation, where nurses can monitor whether they are safely and effectively working. There's a picture shown here, like there's a robotic machine which is automatically will picking up the required medicines and handing over this into nurses archiving to pick up rather than spending the time on the racks for selecting the medicines. Similarly, medication dispensing for patients, where we can prevent pilfering and we can ensure accuracy, and we even wrong drug administration also can be prevented. Exoskeleton robotic transports, where nurses or allied healthcare professionals are required, where these machines can take care in rehabilitation primarily and for other purposes. AI-driven diagnostics and predictive analytics will definitely help nurses, where they take out sample, they put the sample there, and point of care machines can immediately give them records. Similarly, the other diagnostic test, where maybe a bedside, the diagnostic radiological examinations are happening in real time, data is being told to nurses, and also the AI will guide doctors and nurses together that this drug, this surgery, or this nursing intervention is patient-centric, personalized intervention which can be done. And AI-powered patient monitoring definitely will play a huge role in coming time. But why the nurses should contribute to the AI and collaborate for the robotics is it will address nurses shortage about which we talk. It will enhance patient safety. We all know there is a data that 1 out of every 10 patients is being harmed in hospitals. Though this harm is not intentional harm, but this harm occurs because of multiple factors. The infections, the wrong drug administration, the wrong surgery happens, and many more to list. Patient remains at risk when they are in hospital. Supports nurses' well-being because nurses' health also can be taken care. The automated, manual, machine-based work can be done by robots, like lifting, shifting, where nurses can have back problems or maybe muscle injuries and so on. It will improve efficiency and patient outcomes gradually. So these are the major reasons why nurses should collaborate and contribute towards development of AI and robotics into patient care. And when they can do it, there are many opportunities. There are but few opportunities to list are in doing routine tasks. AI and robotics can be used. In critical situations, AI and robotics can be used. Where there's a friction of change, the AI will alert and will also tell what intervention will be more appropriate. In patient rehabilitation, mobility support, and elderly and palliative care, and many more, there's a long list. Now, I'll just touch upon for next 10 slides about symphony of care and nurses collaborating in AI and robotics. The first and foremost is enhancing patient care. So how the AI and robotics will enhance the patient care? AI-assisted diagnostic, early detection, predictive analysis and analytics, and personalized treatment plans, that is either nursing interventions or drugs or surgery, will definitely enhance patient care in totality. There's publications which have clearly informed us that AI in advancing nursing practices, preparing nurses for future, including enhancing nursing practices. So AI and robotics are significantly believed to be helping hands and complementing and supplementing nurses, but definitely nurses cannot be replaced by AI and robotics. Second in line is uh, automating routine tasks like AI powered medication dispensing, where just you show the barcode, scan the barcode, and it will dispense you whichever the drug to be given to the patient. So you know that this patient will these drugs to be given to this patient. You will prepare and you will administer. This will prevent any risk of wrong drug administration. Second thing is there won't be pill phrasing. Every drug will be counted, and when you scan the barcode of a particular patient, this drug will be dispensed for that particular patient. So more accountability, more accuracy, and more efficacy of our interventions, what we do. Continuing the automating routine tasks, I'll touch upon automated documentation and patient monitoring. This is something which is a computer on wheel, we call it as cow, or we call it as workstation wheel, that is wow. This is used in hospitals where you can check this monitor on bedside, make an entry, administer. So this will enhance the benefits of wow and cow is improved mobility and accessibility, enhanced patient interactions, efficient medication administration, real-time documentation. Otherwise, what was happening? Nurse goes, do something to the patient, do the monitoring, check the vital signs, come back to the nursing station and enter either on the paper or on a computer for a data. But this is the real-time data, which either can be directly linked to the monitors or some of the interventions which nurses do and they enter there. Now, research has proven that AI algorithms can automate administrative tasks, prioritize patient needs, facilitate seamless communication in healthcare team, and this enables nurses to focus more on direct patient care and ensures the efficient and coordinated delivery of healthcare services. If I give an example at this point of time, a morning when the assistant nursing superintendent or a ward in charge nurse or ward manager comes and she sees that I have these many nurses. Now, how I should do the patient assignment? Now, if you have a AI will tell you, they know the ability, the strength, the knowledge, the capacity of your team, and they also know the seriousness of sickness of your patients. So they beautifully will align which nurse to be assigned as per their expertise, ability, and strength to this which particular patient, and how many patients to be assigned based on severity of illness to a particular nurse. So this is a routine task of a nurse manager which AI can do in the morning. You can just see this is the assignment. And this assignment can be automated, pop up, and can be delivered to your team members in the morning before they reach, and they know that these are the patients I need to take care. So these kind of administrative responsibilities can be taken up by AI algorithm and can be automated. Training and education can be hugely contributed by AI and robotics, and nurses are in hospital. And we talk about in-service education. We have CNA cells. We have a couple of people who are there, but we have a big, huge brigade of nurses, and we cannot, go and train every nurse because they are working. They have shift duties. All of them are not available. If they are available, they are offs. So in that situation, you can use AI, and they, whenever they are having time, they can come, they can go, they can learn through interactive uh, blended learning programs, or they can walk in skill labs or virtual reality simulation labs, and they can have their learning by themselves, and they don't require much of support from outside, active support from outside. So AI driven learning platform offer personalized education content to enhance professional development. And research has proven one potential application of this technology would be to stimulate settings that are difficult to access in the real world. Health assessment is largely contributed by AI. We have chatbots now, and these chatbots are crucial. You just give your data, and this will tell you what you should do next, what lab test to be done, what more information you need to provide, and what treatment you need to take. So maybe physician will be phased out in coming future, and they will streamline approach to save the time and ensure the nurses having relevant information before arrive to the patient's location. So these chatbots also can help nurses. You have bedside monitors, you have AI-based chatbots, and they will alert the nurse that this patient has a low BP and consistently it is going down, and alert that you consult to a doctor. The inotropic support need to be enhanced in this patient, or similarly for other conditions. And research has proven that it manifests in improved student learning in engagement and intersectional learning experiences such as simulated patient scenarios, gamifications, foster enhanced engagement and outcomes. Additionally, AI and chatbots improve the access to resources by providing round-the-clock support, fostering a culture, continuous learning, etc. AI specifically, and even robotics, can help in patient classification. And the example I gave you, the nurse manager can use it, and they can classify the severity of illness and then the patient assignment to the nurses. Research has proven that physical aspect and characteristics that expresses humanness arguments on whether robots are capable of having soul, and robots may communicate to human-like manner, but definitely the touch, engagement, and feelings, empathy, touch cannot be replaced by robots in nursing. Overall, respondents in this particular study had a positive attitude towards clinical application of AI in nursing and use of robots. Half of the hospital visitors, this data comes from Western world, reported having used AI nursing robots, while 68.5% expressed strong interest and willingness to explore a clinical application of these robots. Now, when we talk about ethical and professional considerations of using AI and robots, patient privacy, data security always remains a concern. Importance of human oversight in AI decision making always remains a cause of concern. Ensuring technology completeness rather than the replace nurses is the key to understand. Is nurses are replaceable? When we answer this question, in a recent paper which I have read, published by Professor Brown, and she said, in her opinion, don't worry, nurses won't be replaced anytime soon. And this article argues that nurses are irreplaceable because they form a backbone of patient care, keeping the patient safe, ensure healthcare system function. There are many anecdotes. They say that nurses are not replaceable because hands-on care, physical assistance, critical thinking, decision-making, emotional support, compassion, human connectedness in end-of-life and palliative care, advocacy for patient, this largely can happen by human beings. Values of nurses in improving personal care as a human touch, emotional support remains irreplaceable. Ability to empathize and connect with patients is a crucial aspect of healthcare that AI and robots cannot replace. If I talk about future perspective, AI and robots will continue evolving in healthcare. Predictive analytics and automation to support nurses' role will evolve. Need for ongoing education and adaptability are desired by all the nurses. And to conclude, AI and robotics enhance nursing but requires ethical implications. Nurses must balance technology and compassionate care and embrace innovations will shape the future of healthcare. Nurses must welcome AI and robotics by open hands, open arms. And they will be supplementary and complementary, but they will not be replacement because they cannot listen much. Technology cannot listen much, cannot engage, cannot empathize, cannot have, uh, you know, the touch, and this will remain with humans. The take-home message is AI and robots are tools to support, not to replace nurses. Ethical considerations and human oversight remains crucial. Continuous learning and adaptability are key for future success. These are few references. And at last, I would like to say that use high technology, but do not forget about high touch, which makes the nurses irreplaceable in healthcare delivery system in era of AI and robotics. Thank you so much listening me patiently. If you have any questions, Ravi, I may answer them. Thank you.
Sure, sir. Thank you so much, sir. Sir, it's actually a very eye-opener thing, and I like the the way that you have put that that phrase that high tech has to be combined with high touch. So I think it's a very fair thing and all. In fact, sir, being a publisher and being a and you also being an editor of the Brunner our publication, which is Brunner Medical Circuit Nursing, that we have WK Waters Studio has always bring out the latest what is there, and we have also adopted to the technology as Waters Kluwer, and in fact, we have recently launched our AI-driven ebook platform, Lipcode Medical Education, and if you just allow me, I can also I can also showcase that how that the technology has evolved. So not only in the practice but also while learning for some topics like this, you can use the AI technologies for your best known textbooks which are available in the market. Like for example, if I share my screen, okay, so I'm just sharing my screen, sir. This screen has I have already opened opened the book which is Brother Medical Surgical Nursing, and how that we are using the AI. Like for example, if I just select any of the paragraph which is given there, for students to understand that particular topic, like this topic is that they have shown is critical thinking. So I just pick up the topic from here, and I also want AI to help me to derive some of the MCQs from this particular topic so that I can do practice also to understand what I have learned, and see that AI has actually helped me to build some of the MCQs based on the top that paragraph text that I have selected. So this is how we can use the technology to also learn it and practice it. Are what we have learned. Not only this tool has given me an option to select color the text. You may share it with some peers. You can copy the link and give it to somebody else. You can add your note, so it's actually a live book. So exactly, sir. So as you rightly mentioned in your seminar, the session, that while practicing AI and robotics are there, very much there as of now also, and they are going to evolve more in the future. But yes, for the learning also, I think there are platforms which are available, and the book that we published that also coming up with such tools, for nurses. With this, I want to open this dialogue, sir, with that if we have any other questions that we want to put across. So I'll just check if we have any questions. Sir, there are a few questions which I want to read out loud for you.
Please.
So there are actually a question, sir. So I'll just read out loud for you. Mhm. So there's a question which is what are the ethical and legal implications associated with the deployment of AI powered robotic nurses in the provision of direct patient care?
See, I have told in the my presentation that The first and foremost thing is that if anything goes wrong by robot, who will be responsible? Human beings can be punished. Can we punish robots? And if we punish one robot, we may produce more robots. Can we imprison them if they do any malpractice? Because they may be, you might have seen few cinemas where robots have done criminality. What you will do with them? And other thing is that what about the data which is being given to these robots from the patient? What is the privacy of these data? So there are many ethical concerns still need to be answered, and globally people are thinking about it. What should be the boundary? What they should be allowed to do? What they should not be allowed to do? And how much we should believe what they are guiding us? They are not the gods. They are a technology which is created by human beings.
So can you hear me?
Yes, I can hear you, Ravi.
Yeah, sure, sir, sure.
There are more questions, Ravi?
Sir, I'm just checking because there are many people who are. Yeah. Yes, sir. Sir, the question, other question is, sir, how would a nurse learn to operate these automated machines like source to enhance the efficiency to operate these machines? Like it is that how do we learn to use these machines in their environment, the current
See, these
environment?
machines are being created, like I talk about automated medicine dispensing. I have seen these machines. So, what you do, you scan a QR code of the patient's data, the particular patient, and this machines is already AI enabled, and this will deliver you the prescription of the patient which is infused into it. Those machines will come out as on airports. You might have seen, you just select a particular beverage or food packet, and then you just pay, and or QR code, you scan, pay, and then you get it at the bottom. Similarly, this happens like you scan the patient's QR code and you say that the today's prescription, and it will deliver the medicines for this particular patient. So this is, and there are manuals which guides you, and there are trainings which happens how these machines to be operated by nurses.
Sure, sir. So there's another question, sir, which is I think quite a legitimate question that if some mistake happens, like as you rightly said, you cannot punish a machine, but you can punish a human being for sure. But if it's a robot and an AI, they can also make mistake. In that case, who should be responsible, a human or a machine?
Yeah, this is how just now said that this is something, a big ethical dilemma, and that is deterring us whether these robots can be used in healthcare or not. And future will provide answers for these questions.
Sure, sir. Sure. And yes, I can see there are many feedback which are coming. And in fact, let me also see if there are some more questions. I'll not take much of a time.
Somebody is Ravi writing, how do we purchase this ebook of Brunner? This is for you to answer.
Okay, I think they have done directly to you. So, sir, for that, what I would do is that basically this platform that the Waters Tour has really introduced is basically for the B2B business. Like, for example, we provide access to you to the institution, and through institutions, the student and faculties get access to all the books that they have. So for that, I can write down my email ID, and you can write back to me. Maybe from the institutional level, somebody can write back to me, and in fact, to begin with, we can give access to the free access, a demo access, a trial to the institution, so they can actually test the platform. And then once the institution has taken the access, then it can be accessed by the student and faculties. So I'm just writing my email ID over here, so people can write back to me, and I can send them the answers for sure. So there's another question which has just come up, which is, can we? Okay, can we use voice assistant in patient care like Alexa, etc., with the help of AI? Well, this is just, I think it's a more of a generic question.
Alexa helps us in few things, like Alexa plays the music for us. Alexa, switch on, switch off the lights for us. So yes, in my presentation, I mentioned that these AI tools can be used for something which nurses are doing a lot of non-nursing activities. Those definitely these machines can help us, and nurses can spend more time in direct patient.
Great, sir. Great. So also, I think there is some feedback they want to give. So what I would recommend is if people have any another queries, and they want to have an access of the ebook, or you want to ask another question, or you want to provide the feedback of this session itself, they can write back to me on my email ID that I have just given. I would be happy to answer all the queries that may arise. And yes, from Walters Kluwer, first of all, I want to thank Dr. Suresh Sharma, sir. Like we actually people have been waiting to hear from you, sir, from a long time, especially from our western part of the country. Like I told you, I was in Ahmedabad and Raipur, and I think many people were asking for you and listen from you. But now I think I think most of them have already joined. So thank you so much for taking the time out, sir, and be a part of this session, for hosting this session for sure. And then from Waters Kluwer, thank you so much for all attendees to joining this session. I think from Waters Kluwer, we keep on providing such interesting sessions to our students as well as faculties. Thank you so much, all. Thank you so much, sir, for joining us today.
Thank you, Ravi, and thank you all the participants being here for last 40-45 minutes. Thank you. Have a wonderful evening. Bye-bye.
Thank you, sir. Thanks.